In the relentless scroll of a social media feed, between memes and vacation photos, a headline screams for attention. Alert! Mark Consuelos health update. Fans shocked by latest reveal. Or the more urgent, Mark Consuelos health scare. What fans must know right now. For millions of fans of the beloved actor, known for his roles on All My Children, Riverdale, and his infectiously joyful presence alongside his wife Kelly Ripa on morning television, the heart skips a beat. A wave of concern, laced with morbid curiosity, compels the click. What happened? Is he okay? What is the shocking reveal? This scenario plays out daily in our digitally saturated culture. A celebrity's name is tethered to the alarming words "health scare," and the internet rumor mill goes into overdrive. However, what these headlines often represent is not a genuine medical emergency, but a complex ecosystem of media exploitation, fan concern, and the often mundane reality of life. The story of Mark Consuelos' so-called health scare is less about a dire diagnosis and more about a perfect case study in navigating celebrity news in the 21st century. This article will deconstruct the entire event, moving beyond the clickbait to provide a comprehensive examination. We will explore the actual origins of the story, separate factual medical commentary from sensationalist speculation, delve into the psychological impact of such headlines on the public, and place it within the broader context of Mark's life, career, and philosophy on health and family. Furthermore, we will use this incident as a springboard to discuss critical media literacy skills, empowering you, the reader, to discern truth from manipulation in an age of information overload. Part 1. The Genesis of a Scare, Deconstructing the Headlines. To understand the phenomenon, we must first trace the story to its source. The shocking reveal that fueled hundreds of articles and thousands of panicked social media posts was not a hospital press release or a somber announcement from Mark or Kelly. The source: a benign talk show segment. The epicenter of the health scare was an episode of Live with Kelly and Mark. In his typical, humorous, and self-deprecating style, Mark recounted a recent minor medical procedure he had undergone. The context was not of fear or tragedy, but of relatable comedy. He described, likely with his characteristic dry wit, the experience of getting a colonoscopy. Colonoscopies are routine, preventative screening procedures recommended for adults over 45. Mark is 53. They are a cornerstone of proactive health care, designed to prevent serious issues like colorectal cancer by detecting and removing precancerous polyps. The scare, therefore, was manufactured not from the event itself, but from its repackaging. The alchemy of clickbait: how the mundane becomes shocking. Online content farms and certain entertainment news outlets employ a specific formula to generate traffic. The hook: a celebrity's name guarantees initial interest. The alarm: words like alert, scare, shocked, update, and must know right now trigger an emotional, often fearful response that bypasses rational thought. It creates a false sense of urgency. The vagueness: the headline deliberately omits key details. What is the reveal? What is the scare? This information gap creates cognitive dissonance, which the brain seeks to resolve by clicking the link. The repurposing of content: the outlet takes a freely available public clip from a talk show, transcribes it or re-edits it out of context, and frames it with new alarming language. The original tone of humor and normalcy is stripped away. In this case, Mark's relatable story about a standard health screening was alchemized into a health scare by removing the context, amplifying the word procedure, and implying a grave revelation. The fans shocked were not shocked by his health, but by the misleading headline itself. Part 2. The Actual Medical Story, a deep dive into preventative health. To truly understand why this narrative was so misleading, we need to appreciate the medical reality of what was being discussed. Let's replace the scare with science and education. What is a colonoscopy? The gold standard in preventative care. A colonoscopy is an endoscopic examination of the large intestine, colon, and the distal part of the small intestine with a camera on a flexible tube. It is primarily a diagnostic and preventative tool. The procedure. Patients undergo a bowel cleansing preparation the day before, which is often cited as the most challenging part. During the procedure, which typically lasts 30 to 60 minutes, the patient is under sedation. The doctor inserts the colonoscope and carefully examines the colon's lining. The purpose. The primary goal is to screen for colorectal cancer, the third most common cancer diagnosed in both men and women in the United States. The doctor looks for polyps, abnormal growths of tissue that can, over many years, develop into cancer. If polyps are found, they are usually removed during the procedure itself. Why it's crucial. Colorectal cancer is highly treatable when detected early. The colonoscopy is unique because it doesn't just find cancer, it can prevent it by removing polyps before they become malignant. Major health organizations like the American Cancer Society recommend regular screening starting at age 45 for people at average risk. Mark Consuelos' age and risk profile. Mark Consuelos was born on March 30, 1971. At 53, he is squarely within the demographic for which colonoscopy screening is standard medical practice. There is no indication that his decision to undergo the procedure was due to any specific symptoms or a family history of cancer. It was, in all likelihood, a responsible, scheduled, and proactive step in managing his long-term health, the very opposite of a scare. By framing a routine, life-saving preventative measure as a frightening event, these headlines inadvertently create a negative association with essential health care. They contribute to the stigma and fear that prevent many people from scheduling their own screenings. Part 3. The Anatomy of a Clickbait Health Story, a 5,000-word media literacy guide. The Mark Consuelos incident is not an anomaly, it is a template. Understanding this template is key to becoming a discerning consumer of online information. Let's break down the common tropes of celebrity health clickbait. Trope 1. The ominous health update. This phrase implies a significant negative change in status. In reality, a health update could be anything from "I started taking vitamin D" to "I ran a marathon." It is deliberately nonspecific to allow for worst-case scenario imagining. Trope 2. Fans are worried, sad, or shocked. This is a classic projection technique. The outlet claims to speak for the entire fan base, creating a bandwagon effect. It makes you feel you are out of the loop if you are not also worried. Often, the worry originates from the outlet's own article and the comments they solicit. Trope 3. What you must know right now. This creates a false emergency. It suggests that the information is critical to your own well-being or your ability to support the celebrity. It leverages FOMO, fear of missing out, and a sense of duty to compel a click. The out-of-context photo. Articles like these are often accompanied by a photo of the celebrity looking tired, sad, or unusually thin, perhaps taken mid-blink on a windy day. This visual evidence is used to corroborate the fabricated narrative of a health crisis. Sources close to and an insider reveals. To lend an air of credibility, these pieces often cite vague, unnamed sources. A pal, an insider, or a source on the set can be invented to say anything, as they are unverifiable and immune to accountability. The psychological impact, why we click. Understanding why these tactics work requires a look at human psychology. Negativity bias. Our brains are hardwired to pay more attention to potential threats. A health scare headline registers as more important than "Mark Consuelos shares funny anecdote." Parasocial relationships. Fans often develop one-sided, intimate feelings toward celebrities. A perceived threat to a celebrity we feel we know triggers genuine concern, similar to hearing about a problem with a distant acquaintance. The information gap theory. Curiosity is an itch that needs scratching. A headline that poses a question, What fans must know or creates a gap in our knowledge, latest reveal, creates an unpleasant feeling of uncertainty that we are driven to resolve. Part 4. The Man Behind the Headline. Mark Consuelos' genuine approach to health and wellness. To fully dispel the myth of the health scare, we must look at the consistent long-term picture of Mark Consuelos' lifestyle and public persona. The narrative of a man in fragile health is starkly contradicted by the reality of his life. A life of physical activity and vitality. Anyone who watches Live with Kelly and Mark or follows the couple on social media sees a man brimming with energy. Fitness enthusiast, Mark is known for his dedication to fitness. He has spoken about his enjoyment of boxing, weight training, and various other forms of exercise. His physique is a testament to a sustained and